questions.
Welcome, everyone. Thank you guys so much for the ones that are here on campus, the ones that are live streaming, the ones that are watching this later on. So we got this panel together today because there's a lot of anxiety going on right now. You guys are applying for jobs. You have tons of questions. You are in leadership and management courses that are helping you create resumes and get ready for job interviews. And so it's kind of easy to hear when it's coming from us, but I sometimes think it's better to come right from the people that are in the position to make the decisions that you guys are so very interested in. So I am not going to stand up here and talk your ear off because you didn't come here today for me. I'm going to let our panel introduce themselves, and then if you guys have questions here, this is going to be super informal. You guys on the live stream, please type your questions in, and we'll try to see that we can get to everyone's questions and get them answered. So, hand this off.
Hi, I'm Lacey Greer. I'm the manager of the medical ICU at Del Seton Medical Center at UT.
I'm Sarah St. John. I'm a clinical nurse supervisor on the 7th floor at
And I'm Erin Jackson. I manage for East West, which is a hodgepodge of everything med-surg.
So our first question is the title of the panel. What do managers look for when you get ready to hire someone?
So really getting in front of us at the open house is where we get the bulk of our interviewees. So if you're doing the RN residency with Seton, they host open houses prior to, so when was the open house? Late January for the July cohort that we hired into. So most of us have already hired everyone that we're hiring for the summer. So it's pretty early. And so talking to people, letting us know why you want our site or why specifically med-surg, oncology, NICU, SICU. A lot of the units interview together just because, like for med-surg, I interview with 2 other tele units just because the patient population for our units are more medical, whereas Sarah's unit and another acute care floor at our hospital are more surgical. And they interview separately just because one is like ortho trauma over plastics and burns, and then Sarah's unit is oncology and other surgeries. And so it's just a very different patient population, and you want one or the other, so it doesn't make sense for them to interview together. But this go around, we went quickly. So we saw people, the recruiters, we gave resumes of people that we were interested in at that time to recruitment. They were setting up interviews. We interviewed within the next 2 weeks, and we have decisions made. So it went quick. Like I have some ACC students that are level 4 that do clinicals. Like this is their S2 semester. ACC calls it level 4, but S2 for you guys. And one person asked me last week, like, oh, what can I submit my resume? And I was like, oh, that ship has sailed. Like it moved quick. And so it's kind of the early bird gets the worm.
I would second all that. We get a bulk of our recruits from that fair. I do get ones from on the unit when they are doing their clinicals or rotations that will come by my office. I like the people who seek out the opportunities. That's what I'm looking for, is those people who are seeking out those things. So I have many times students will stop by and say, introduce themselves to me, give me their resume, say I'm on the unit right now with so-and-so. I like X, Y, and Z about what's going on here. I'm interested. Can I have your card? Can I email you? So those are kind of, I'm looking for those go-getters to hire for my unit.
I've even had applicants that maybe we were in the middle of the process and they were in clinicals but not on my unit because like I don't have any UT clinicals on my unit. That's just the way that, I don't know, the whole whatever y'all use to provide clinicals for the city, how the cookie crumbled. So I have all of the other schools, but UT's not represented on my unit. But I had someone that was just looking for a job and was that go-getter and came with a resume and was like, I don't have an appointment with you. You're busy. Like, I'm going to just hang out in the waiting room until you come to me because I want to talk to you. And I was like, dang, like she has some cojones. I like it. And so, like just putting yourself out there, that's not comfortable, and not something that maybe even when I was a nursing student, I would have thought to do. But like Lacey said, I definitely do get the S2s. Like if my team is vouching for someone as a student, like this person has done a great job in their last semester, or even second semester students that come back and do level 4 or the S2. If someone knows that they're a good fit or that they have shown or improved themselves in clinicals to be a good, critical thinker, and someone that's going to do the right thing, like I can teach you how to be a great nurse. I can't teach you how to be a good person. So I take my team's consideration very highly.
I would just say and probably your last semester more than any other semester is your job interview. So if you are on a unit that you feel like you want to work on, or you enjoy, definitely do your best, do the most that you can, talk to the managers. And then they also kind of share. So if she's full, she's like, I've already hired 5 people. And Lacey's like, oh, well, I interviewed this person, but I just can't hire her, or I need somebody. Erin would be like, I interviewed this girl, she's great, I think you should interview her too. So often they kind of share.
Talk amongst ourselves
Yeah.
to hand people off if we don't have space for them, but we feel that they'd be a good fit in our hospital or on one of our cohorts units.
And the same goes for negative. So if you, like this last open house, I overheard someone telling Lacey and Nicole the reason they wanted ICU was because they didn't want to deal with family members. So I was texting them did that person really just say that was the reason why they want ICU? So be thoughtful about why you're choosing units that you're choosing. Because when you tell ICU that you don't want med surg because you don't want to clean up poop, we're definitely talking about that amongst ourselves too. It goes both ways.
Good, bad, ugly.
Good, bad, the ugly. Yeah, we're all in it together, so we're sharing that information.
Let me ask you these questions. So as far as resumes go, is there anything that is the resume killer? As soon as you see it on there, you're absolutely not. And the opposite of that question, is there anything specific that you guys will look for in a resume?
I think with me, I don't really care about your GPA that much. I mean, if you failed all your classes, yeah, maybe that's a concern, but I've seen it quite frequently where GPAs are on your resume. That's not really I'm really more interested in your clinical judgment, your clinical skills. Some people have full-time jobs, you're just trying to make it through school, and I understand that. Did you pass your NCLEX? But the thing that I look for that I really like a lot, I look for people who played team sports, because that means you can take direction and you're part of a team, because that's a huge thing on my unit is that you have to be a member of the team. I mean, ICU, you depend on your coworkers to help you out during times. You depend on that direction. So that's something that I love. So if you were in high school and you played, at high level sports or in college, or even if you do intramural sports, I know once you get to nursing school and into the core, extracurricular activities are pretty lean, and but that's a huge flag for me of something that I look for in someone, because that shows me that you can play a part of a team, be a part of the team. I love a waiter or a waitress, because it means you can multitask. A bartender, so don't think that I attended bar for, that's a lot of multitasking. That's a lot of customer service, because nursing is a lot of customer service. It's a lot of sales. Whether you realize it or not, your job at the, Urban Outfitters counts for something, because you're selling a diagnosis, you're selling a care plan to your patient. So you have to think of that's what you're doing here. So those are big things that I look for. So even if it was a summer job, put it down, because that's what I like to see.
Yeah, we would rather see non-nursing or non-PCT or tech CA work and see what you've done. If that's being a nanny, you manage the household for someone else's children. That's important. So we know that you can deal with tantrums, big or small. And so don't discredit anything that you've done. Put it out there. if it's volunteer work, if it's church work, whatever it is. It just shows us that like how well-rounded you are. And I was the bartender waitress who had no hospital experience, who was like, oh my gosh, I'm not going to get a job in this hospital that I want to get a job in because I've never been a tech. And like not everyone's going to be a tech. No one has the time sometimes. They don't pay a lot. So we understand that you're trying to live life and you have to do what you have to do to get through school. So we're not judging you for that. And yeah, put anything on there that you think is relevant, even if you think we only want to see like hospital related experience.
What about an interview? So people come in, we're preparing, trying to work out and practice to come in to do this interview. Same question. So are there things that people have done or said that during the interview where you just go, all right, this is going to be the last question and we're going to wrap it up here.
If you don't if you can't look me in the eye when you're answering a question, I don't trust that you can go into a patient's room with strangers and have serious conversations with the patient or family members about health care issues. If you're so nervous that you can't function, then that usually is when we're like, ooh, that's a red flag. Nerves is normal, right? Like I hired someone who straight up started off with a squatchy chest and it spread to her face by the time the interview was over, and she's an amazing nurse. It's just a stressful situation being in a room, and because I do the panel interview with those other 2 units, it's 3 managers in a room. I get that that's a stressful situation. I did not hold that back. I hired her. But I think that you guys beat yourself up and you just get really worried about did I say the right thing? One person accidentally cussed because she was telling a story that a patient, and they said a curse word and she was like, oh my goodness, I said this word. Now I just said it again. That shows me that you're a human and that's okay.
I would agree. You're going to be nervous and that's okay. Bring a bottle of water with you. That's the thing that I try to have, because we panel as well in the ICUs, both ICUs interviews together. So there's 4 of us who come up and you sit in front of, and so it can be really intimidating. So always bring a bottle of water with you. That's totally fine. We like that.
But maybe not the full sandwich. That's happened.
Yes. Yes. Please don't bring food. Yes, I have had that as well. Please don't chew gum. That drives me insane. I understand your mouth is dry. That's why you should bring water. But I would just say that know the unit that you're interviewing on. Know what that patient population is. Even if you have to Google what is a medical ICU, it's always kind of concerning to me when people come in and tell me how excited they are to be in the ICU, and then they have no clue what my patient population is or what, and then they'll start talking about patients that I don't see, we don't do, it's not. So that would be this researcher unit. Know, and even because they are very specific, especially in some, and then Erin's unit can be very much a hodgepodge. But I would just say, know what the hospital's mission statement is, know about what you're getting into, and then be able to develop pertinent questions from your research.
I would say be prepared for questions like, what conflicts have you had in the past in your professional jobs or in any of your jobs? We're always going to ask you how to resolve conflict. We want to know how you can resolve conflict and customer service type questions for those patients who you need to do service recovery with, because that will happen. And know, like she said, know the unit you're interviewing for. Along with that, definitely tie a passion that you have in with the unit you're interviewing for, if you have one. And I would say interview for the job that you actually want. It's very obvious when you go to when you have an interview and you can tell that person really wants peds, but you're an adult oncology unit, because we're just gonna be like, they don't want us, they really want to work somewhere else. But definitely have a conflict, like, even if you haven't had a conflict,
You've
in
always
your
had one in
job?
nursing school.
yeah.
Team group projects, you always have a conflict.
When we ask people that
Makes
question,
you
they
cool.
sit there, I'm like, you're not human if you haven't had to deal with some kind of conflict, tie it into something, have it prepared in your head that that's what you're gonna go with.
And I think all of us ask a lot of situational questions. So tell me about a time when, and then insert XYZ. So just think about patients or situations when you have had a communication issue, when you've admitted a mistake, when, various things, but just kind of trying to go through and have, like if you interview or if you Google like interview questions 101 or something, there's a list, right? It's out there, but it's more behavioral interviews. And so we're looking for you to provide that situational touch too.
So backing up to resume, so I know you guys talked about how the GPA is the most important factor. What about listing the clinical rotations that a student has had during nursing school?
If it's local and we know it, then sure. But if it's not, and I don't know the program, then I don't care. You can tell me all of the like Louisiana places you've been, but like for you guys, if you've been in our facility, then I would like to know where you've been.
I think if it's relatable to the job that you're applying for, put it on there.
Yeah.
Like you've been in our hospital.
Yeah, I agree. If, you may have to tailor your resume depending on what, but if it's somewhere in our hospital where I can be like, oh, Erin, you were on Erin's unit. Tell me about that. Tell me about what you did. But I mean, honestly, as GNs, as nursing students, they'll all kind of do very similar rotations school to school. So really the thing that stands out is if you were in our hospital and on one of our units doing your capstone or something like that.
What about lying during the interview?
Lying?
Lying?
Like telling stories. Not true.
I would advise not lying.
Yeah.
I don't know how we would catch you in that since we don't know you, but that's starting off on the wrong foot 100%. I think if you don't have a situation, I would rather you be honest with me and say, can I come back to that? I can't think of anything right now, versus just like making something up to sell something. Because there's always something that sticks out from an interview that we that's our one thing that we, grasp onto. So if we do hire you and then ask you about that situation, if you tell me that you made it up, I'm going to be pretty pissed.
And I mean, not this storyline, but I would be conscious about name dropping people who you think work on my unit.
Yeah.
And,
Unless they specifically said, drop my name.
or saying you have this great relationship with him, and then I go ask them, do you know this person? They're like, I had him for like 2 hours the other day when they rotated through. I don't really know about them. And then on the opposite side of that, I've had it at times where you've spent, time on the unit and you told me how amazing it is and you were with this amazing nurse and she taught you so much. And I'm like, who are you with? This is great. And you got no clue who that, I'm like, write it down somewhere. Because if you're going to tell me how great this is, I want to be able to go back to the nurse and say, yeah, they spent 8, tell me about them. Like, what was your interaction like with them? Were they asking good questions? Were they, helping? What were they doing? Because remember, anytime you're on that unit, that's a job, on the job interview as well. Like, I'll go back and reference that nurse who you were with. So remember their names. If you're gonna drop that you had a great time on that unit and learned so much, remember who you were with.
You guys are friends. You guys have any questions?
What's that little thing that answered my question, Daddy?
If, for you guys that are on live stream, if you have questions, just type them in and we'll cover them as they come in.
Would you guys be able to describe for us, just give us a behind the scenes of what it's like for you as a manager, thinking about how many people you're gonna hire, and then when you get, what does that process look like? The recruiters get the names and then pass them on to you, and how many people apply for this job? jobs, and are they from all over the US or just Texas, or like, just describe that for us.
Yeah, so for the residency, most of it is through that open house, like I said before. And people come from all across the US for the open house. People fly in to come to the open house. This last one lady I met was from California, looking to like completely transport her whole entire family to Texas. We interviewed her and didn't end up hiring her. I think the farthest I've hired someone though was from the East Coast in like Maine, but that was for an experienced nurse. For GNs, they still do come across the US, but we will have anywhere from like 300 to 500 applicants like show up in person at those recruitment events. And then more people will just submit resumes online. The resume submission online, the recruiter is phone screening those people to see, like, did you just like blast, submit resumes to every open position? Or like, do you truly have a passion for a specific unit or a specific site? Because the recruiters come, they know our units. Like, we have worked with the same group of recruiters for the graduate nurses for a while now. Letitia is for acute care. She's my recruiter, and I've had her for like 2.5 years. So I know her face. She knows my unit. When she's on site, like, she'll come up and see the floor, see how things are going, check in with nurses that already work on the unit, just so she can get a feel for the culture.
I think as far as deciding how many people we're hiring, we kind of have to do some predictive forecasting because it is such a far out time. And then also it takes you anywhere from 4 to 6 months to get off orientation and be on the unit.
That's ICU.
Yeah.
Acute care is quicker.
Yeah.
12 weeks.
Yeah, it's usually about 6 months before we let you on your own in the ICU. And even then you're still on orientation. We're just kind of letting the leash a little bit more. But yeah, on average, I don't hire a ton of GNs into the ICU. I really like fellow nurses, which is another program we offer for after you have about 1.5 to 2 years of acute care experience. Then we have a fellowship to transition you to the ICU, and it actually makes my best nurses because I'll be honest, acute care nursing really builds you as a nurse. I wish everybody would go through it. So I usually hire maybe 2 to 3 GNs at the most, but then I try to hire like 4 fellows at a time. So if ICU is your love and you don't get in that first round, do this because you'll actually be a stronger ICU nurse when you come out the end of that. But yeah, it's usually just kind of a prediction of where I feel I'll be. Like if I know people are leaving me to go back to CRNA school or, are about to graduate with their NPs. And so I kind of just have to kind of predict, like, where is it happening? And, someone's going to have a baby. And then I know they're going to go part-time after they come back from maternity leave. So I'm going to need to fill this gap. So
yeah. And it's frequent check-ins with the team. And so, like, I have someone who just finished his 1 year. He'll have 18 months this summer, and he's going to the SICU for a fellowship. But he told me before he even applied. Same with, you build a rapport with the people that you work with. And so I have a nurse who is looking at moving back to Boston because that's where she's from. And it's like 9 months down the road, but she wants me to know so that I can prepare. And I think that you build those relationships so that people are open and honest with you. I'm also never I want you to go move on and do other things. I want you to do the fellowship. I want you to go to PEDS ICU if that's like your forever dream. I don't want to be the person holding you back from those. And so I'd rather just have an open dialogue. So like this summer I have 5 positions, filled those 5 positions, but it's because I know that I'm going to be losing people. And it's always better to be slightly overstaffed than understaffed. People want to take vacation in the summer, and no one wants me to say like, "Oh, sorry, all of our spots are filled. You can't go to your, Florida vacay with your family that your mom is paying for." I would go for that free vacation.
kind of to piggyback off that question, like if students, especially new grads without experience, if they are wanting, like they know they want to be an NLP as kind of stepping stone, how much do you want to know that? Knowing how much it costs to train someone, and knowing that we're all working on retention of staff. Is that something you want people to say in an interview?
We will ask about short-term and long-term goals, so we want you to be honest with us, but if you tell me that you want to work for me for 18 months so that then you can go work for Lacey for 18 months to then go to CRNA school, like we're probably not going to invest our time and effort in you, because then you're just kind of like still using that. That's a fine line with like being fully honest, and we spend a lot of money on these residencies, and so we want that return on investment. So for acute care, that's the 2 years before you move on to something else. Like if you give me 2 years, I'm not going to be mad at you, no matter where you're going.
Agreed. I feel like 2 years is kind of my, and we asked, like, what's your 3-year and 5-year plan? And so 2 years, I kind of feel is where it is. If you to ask me, what does my time in the residency count as ICU hours for CRNA school, I'm like, but I know ICU is a stepping stone for a lot of advanced practice degrees, and I recognize that and I realize that, and I hope that while you're on my unit, I can give you the tools and the opportunities to set yourself apart for when you do apply for these programs, so that you look better and can show them that you're an outstanding professional and have the capabilities. So I always tell people that, like, I know this can be a stepping stone for you, and I hope that you can invest in my unit and do work here that will set you apart from other people. So yeah, I feel like that, at least tell me you're going to give me 2 years.
Thank you. So we do have, I think 12 or 13 people online joining us. So we do have a couple questions. Rachel wants to know, would it seem inappropriate to follow up with a manager to express your continued interest in a job position, even if you did not get chosen after an interview?
Yes, because even if we didn't choose you, we always kind of have people in the back of our mind who were, next to if someone declines, or sometimes people don't pass their NCLEX. It happens, I've had it. And so then I've had an opening, and, if it's in a timely manner, I may be able to reach out to you and say, hey, this position opened up. You may have not found your dream home, your dream job yet. Are you interested in coming to my unit? So I think it's always appropriate to send that follow-up email and say, thank you for that opportunity. If something changes, I would still love, or, be interested in coming to your unit.
Yeah, we had someone recently who applied, and I don't think that we didn't pick her for any major reason, but just some other applicants were better. But she did email us back and say, do you have any recommendations on how I can improve my interview, or is there something else you're looking for? And we thought that was really intelligent and showed a lot of professionalism to go back and ask those questions.
Yeah, kind of a follow-up question to
Can you
that.
say it really loudly?
I have a follow-up question to that, specifically that did happen with me. I went through the interview, I did a picture, and I did email them back asking, where can I improve? And they never responded, so I was just wondering, is that because of the busy schedule, or what does that look like for details?
I can't speak for that manager or person, but I would definitely, if I were you, I'd be like, I don't want a manager like that.
If someone takes the time to reach out to me and ask for feedback on their interview, I think it's respectful of your time and efforts for me to respond. And maybe it's within a week because it is busy, but I respond to everybody who reaches out to me.
The managers are constantly checking their email. It's on their phones. It's like, all the time. So if someone didn't answer you back, I don't know that you, I don't know if you want to be there, honestly.
Yeah,
But that's just,
I agree. Like I make an attempt to reply back to everyone. So if it was me, send it to me again. I do get about 150 emails a day that I have to weed through, and but I do try to make an attempt to give anyone feedback who asks for it. And sometimes I honestly don't really have great feedback for you. It's just there's a lot of people vying for 2 jobs. And sometimes it goes to the person who had the capstone on my unit, who I saw every day. So, I mean, unfortunately, sometimes that's just how it goes. And I've had a lot of people who had great interviews, and I just didn't have the space for them. But yeah, I do, and like I said, it can sometimes be a week, 10 days before it'll be starred, like, gotta get to that, gotta get to that.
And ultimately, our goal is to provide as many people in the community with jobs here, right? So we're constantly talking to each other. And if, like Sarah said earlier, if there's a candidate that maybe wasn't a best fit for us, like we're sending those resumes and forwarding them to other leaders in our facility, or giving them back to our recruiter, because they recruit for the network. And so maybe like Del Seton doesn't have a spot for you, but maybe, Seton Medical Center Austin does, or Seton Northwest. And perhaps that wasn't your first or second choice, but you're willing to look at those places because you weren't picked at our facility. But we're trying to not duke it out for one person, because then other people are losing out on those spots, and we're losing out on quality candidates. So that's why we do these panel interviews together, so that we can get the most people hired in.
Thank you.
Going back to resumes, so sometimes the students are told to do like a summary objectives sentence or statement at the top of their resume. Is that something that you guys look for, or does it matter?
I only look for it if you put that you want ICU and you're applying to my spot in MedSurg. So like if you're going to have an objective, make sure that you're tailoring it to the location that you're applying to. If you don't have an objective, that's not a deal breaker for me. But when you put that like pediatrics, ICU, and emergency room are your top 3 choices, then I look at your resume and say, then why are you submitting it to acute care?
When will the next cohort of the residency program application and start date be?
So we only hire 3 times a year. So it's always in like January, February. It like that one waffles between the start date, like either late January, early February, July, and October. And they would need to look at the residency webpage for dates. All of the open house dates and times get added to that website.
But they usually are, almost 6 months before the start date of the job. So like for July, we had the open house at the end of January.
For October, we usually have the open house in like June or July.
Thank you. Do you inform applicants they were not chosen at the same deadline of calling those that you did hire? When do applicants normally hear back?
That's interesting. So we give all of our yays and nays to the recruitment team. And so usually we ask that they call people back and let them know if they were not selected, just because when you're doing so many, it's kind of hard for me to keep up with calling everyone that we interviewed, because we do like 3 solid days of interviewing people every 30 minutes. So that's a lot of, it's a very fast. And so we usually give it back, and we ask the recruitment team to let people know. If you have not heard back from our recruitment team, if you interviewed with one of us, I would ask you to please let us know, so that we can follow up on that end.
Don't feel like you should reach out to the recruiter that you have sent all your stuff into. Reach out to them too.
Thank you. If I was unable to attend the career fair,
What is the best way to apply and not get lost in the hundreds of online applications?
That's where you come and seek us out.
Swing by the office.
If you're really passionate about one of our units and you weren't able to come to that fair, then that's when I would say you come to one of my supervisor's offices. You know, if I'm not there and you say, hey, I really want to be here, this is my passion because of X, Y, and Z, here's my resume, hound me, you can email me, yeah. But you have to set yourself apart. If you weren't able to do it at that fair, then come get us.
I have had resumes emailed to me from applicants that never stepped foot in our site, but really wanted to be at the level 1 trauma center for adults. They had co-students, like colleagues that had clinicals and just knew that they wanted to be at that site. I've had clinical instructors reach out to say, you know, do you have any positions open? I have a student that would be really good. And those are, you know, kind of going the extra mile. And it's only been clinical instructors though that are on our site. So they know me, that's why they have my email. But I hired the person that sent me her resume. She had to interview for the job. It wasn't just based off her resume, right? But she was a quality candidate.
Are your departments able to work with students going part-time in a master's program 2 days a week?
They're gonna do the AE program part-time, or
I'm thinking that's what this person is asking about.
so for alternate entry, I actually graduated from that program here. You have to go part-time for school because trying to do full-time residency and full-time school, I've never seen anyone successfully do that. I got hired at Seton before this residency existed, so I did part-time work and full-time school. That's not an option now that we have that residency program. So if you know that you're going to have class on Mondays and Wednesdays, as long as it can be accommodated with the residency program classes, then we can manage your school schedule.
The ICU residency is a bit harder because it's longer and we have a lot more class time that's scheduled that you have to attend, and we have these extensive modules that we make you come and sit and do 8 hours of a week as well with your class time, and then your precepted time on the units. So honestly, I've not had anyone successfully be able to manage it in the ICU setting. And I mean, you know, we have people like I have someone who's working on her BSN right now, who was an ADN who is working on a BSN, and we're still having to work with that, trying to coordinate, which is very limited in her outside class time. It's rough. And then we run into the situation of your preceptor, because you have these days that you need to be in class, so you don't get the same consistency with the preceptor. And so we've had this issue where, you know, you kind of like take 1 step forward and then 2 steps back, because with the new person this next week, and they're not quite sure where you are in your learning path and what they, you know, can let you loose on. So yeah, it's been rough.
I think it's hard to excel as a brand new nurse and only be part-time, because you're not getting as many hours and experience that you need to really excel and get the full nursing experience of. So I don't know that we've hired anyone from those programs in a while since the residency thing, just because I think it's really hard.
I currently have a nurse who's in the program, and he is about to finish his last semester, but he dropped to part-time for school while he was doing the residency, and then he had to go part-time after he finished the residency to then focus on school. And then he's been PRN because then school ramped up, and then he is back to part-time, but thinking about going PRN again. And so it's really like, for your family, do you need insurance? Can you afford to only work 1 day every 2 weeks? And I mean, that's things that we can't answer, right? Like once you've gone through the residency program, those full-time hours are not negotiable. But once you've gone through it, then you know, can opt to go part-time. But like Sarah said, then you aren't seeing as much kind of in real life.
If a student is unable to do a residency the first 2 years, can they still apply to a residency after 2 years, even if they've had nursing experience in another organization that was not a hospital? For example, a nursing home, psych, or clinic.
Yes, but you would have to do a fellowship. So I hired an experienced nurse. So my unit is unique at Del Seton in that we didn't exist at BRAC. And so my unit, I brought like 3 nurses over with me from BRAC from other units that I stole from. Thanks, everybody else. And then everyone else was new, like a new grad or just new to our facility, but experienced nurse. And so that particular nurse came with home health experience. He'd been a nurse for like 12 years, but it had been probably 7 since he'd worked in a hospital setting. And it was very apparent from the start that like he needed to go through the fellowship. And so while I don't normally open positions for acute care for fellowship, because most people that work in a clinic setting or a home health setting aren't looking to come to a hospital, or like someone who's in women's health is not looking to like transition to acute care. So fellowship is usually open in the ICUs or in the emergency department. I opened, like we just switched him over into that program. And so he joined the new grads in some classes and kind of like hospital policy and, you know, things. And now he's a charge nurse. Like he did just well, just fine.
There's one more question. I wasn't sure that I understood it, so I asked if they could retype it, but maybe you'll understand it. Let me see. So initially it was how much experience as a teaching assistant in nursing school valued? So how much is experience as a teaching assistant?
Like if they have experience as a TA.
Yeah, but then I was like, for me, you have to have nursing experience to be a TA, so I wasn't sure what they're asking. So then she said, I asked for like just a little clarification. She said, with no clinical nursing experience outside of school, and then with clinical nursing experience. So I asked her to, I said, can you just send it in one text so I can ask it?
The student maybe asking is, let's say I'm in the AE program and I get my RN.
Yeah.
And I'm still in school though, so instead of deciding to come work in the hospital, I decided to be a clinical teaching assistant, like in a skills lab or something like that. So now the program's over, I'm ready to start working because now I can focus my full time on it. So, but it's been 2 years since I graduated. I didn't work in the hospital, so I come now to put my application in. Do you guys count that?
So real quick though, because
The resident-
you have to have 6 months, because I was a TA, you have to have 6 months of nursing experience to be a TA.
The residency requires anything, so you have to do the residency if you have 0 experience up to less than 1 year of experience. So like my sister-in-law is a labor and delivery nurse at another facility within our system, and she knew that she wanted to do that. She also is a graduate of the AE program, and she couldn't work. She wanted to do full-time school, and she did not like want to waiver from that. And so she went and got a clinic job at a women's health clinic, got a year experience in that clinic, bypassed the residency by getting a year experience there as a nurse in the clinic, and then used that to get her foot in the door where she is now. And she's been there for the last 10 years, delivering babies and taking care of postpartum patients. So as long as you have a year of experience in nurse, but it has to be in nursing
Like
somewhere. So I don't know if the working at the CEC would count with our recruiters, but I don't know that policy.
I think it looks good, better than not having a job at all. But we're also asking, I know our unit is often asking, like, how many patients did you take your last semester? What are the most patients you were able to take care of successfully your last semester? If you have that gap where you're not really taking care of patients, for my unit specifically, like an acute care unit, it would make it harder. Like you wouldn't look as good as the person who was taking 4 patients at the end of their semester, and they just got done with that. So you haven't taken care of patients in 6 months.
So maybe consider like a non-intense clinical setting. Yeah, thank you. I think that's all the questions that I have online.
You guys are for any
We have
questions?
14 people. Yeah, no, I think this is good. Okay. Thank you so much. Oh,
Last
sorry.
words of advice.
I feel like we asked a lot.
I would say if you're in an interview, just at least show something that you're passionate about, particularly with nursing, and make sure you portray that.
So I will say this, people are gonna ask you to like name your strengths or like redeeming qualities about yourself. Like we all got into this profession because we're compassionate and we're caring. Come up with unique individual traits, characteristics about yourself. Talk about a hobby that you have that is interesting. Like tell me something about yourself that's gonna set you apart from the 25 other applicants. Like Lacey said, we're like interviewing back to back multiple days in a row. So sometimes it's just like that extra piece of you opening up about yourself and telling us something like a joke, anything, but then it makes you more relatable. And then it's like, oh, you're the girl who plays the flute, or you're the girl who went on a mission trip to Honduras versus like, you know, you told me that you're caring and compassionate and you love people and helping people. We all do.
I will say, tagging on that is showing your personality. We always ask you, like, what do you do for stress relief? Because nursing is very stressful. And I always get, you know, I run and I do yoga. And I had one girl who went into, you know, I do yoga. And then she said, oh, and I also race cars. And I was like, what? Like, and that opened up a whole new conversation. And at the beginning of that interview, I had no interest in hiring her. Like, honestly, it was kind of pretty, like, blah and very robotic. And then as I was like, you race cars? Then she opened up, and then all this stuff started coming out, and she was so personable that was never there at the beginning, that I was like, oh, okay, I can see how you know, can relate to your patients, can do. So find that fun thing that you do that's kind of weird and unusual, and it's okay, like, because I do a
You're
lot of
weird too.
weird. Yeah, that's how we got into this, because we're all a little weird. So yeah, tell us about that, because that's really, like we said, in those 30 minutes when we're banging through people, that's, I was like, remember the girl who raced the car? Maybe we should, let's bring her back for a follow-up interview.
Yeah, so one of the nurses for acute care just hired a tech who was a boat captain. And like that, I just know that from eating lunch with Justin. And like he hired a boat captain. So yeah, something to set yourself apart.
With that, we're also trying to see if you fit in with our team, and so it's good to feel like you want to work somewhere where you fit in. So showing that side of you is like everyone else going to be like, oh, that's cool. That's something you can talk about.
We have one quick question that just came in after your closing thoughts. How long is the class-like portion of residency? 16 weeks?
For acute care, it's heavy in the classroom for probably the first 8 weeks. You go to class 1 or 2 days a week, each week for those 8 weeks, and then it kind of tapers off. But you still, even though you're on your own, you don't graduate from the program for a year. So you still go to 1 class a month every month until that year is up, and then you have like your graduation ceremony. It's longer for the ICUs.
In ICU, it's 22 weeks that you're doing classroom time, precepted time, and then after that you will start taking patients on your own, but there's still like a monthly class time that you have to attend, and practicums and stuff that go throughout that whole year until you finally graduate, because you also work on a project, an evidence-based project throughout that time as well, to present at the end of your residency.
You present it at that celebration. They put your poster, it's like a poster presentation. And then people go and vote and put stickers on which poster presentation they like. And then the top 3 posters have to present. And it's family, friends, managers, all of your coworkers that are in that same like graduating cohort together.
Residency is really another year of school. Like, you're not finished. And that's what I always tell people as well. When you do the ICU, it's another semester and a half of school that you're going to go through. It's not just 3 days a week and then you get to watch Netflix the rest of the time. Like you're going to go home and study and go do more classwork. And then the preceptor is going to give you a sticky note of stuff that you're going to have to go look up because there wasn't enough time to talk about it during your 12-hour shift. But she's going to want you to know about it tomorrow when you come back to work and you have those patients again. So that's always been a warning too in interviews is be prepared for the amount of hard work it is to be in the residency for either acute care or ICU.
But you get paid.
Yes, yeah, that is nice. You do get paid for it, yeah.
One more question came through, but I'm going to leave it to you guys if you want to answer it or if you want to.
Yeah.
Because you've been more than generous with your time. Thank you. Okay, last question, guys. Sorry. Could you talk more about the fellowships? Is that for nurses that have experience? What does fellowship entail?
So I'll take this one.
Yeah.
Because
She hires all the fellows.
I hire a lot of fellows. So the fellowship is another residency program that we have at Seton. And it's designed for people who want to transition into the ICUs or into ED. And so we look at people who have acute care experience. About 18 months to 2 years is what we're looking at, unless one of them says, I have someone who they've been a nurse for a year, but they're ready to come to you, like they're on their game, and then we will allow some exceptions with that. But it's pretty much someone who has been an acute care nurse, or I've even hired a mother baby nurse who was looking to transition to the ICU. You have about 18 months to 2 years, so you know how to be a nurse. You know about time management, you know how to hand out meds, you know how to assess. And so then you come to the ICU and you spend about 12 to 14 weeks just really focusing on ICU. Not learning how to be a nurse, not learning how to touch patients, not spending 10 minutes flicking air bubbles because you're so nervous. Like you've already gone through all those, you've gotten all those kinks out. And so now you can just spend 12 to 14 weeks just focused on learning those critical care concepts, learning the drips, learning the meds, learning all that stuff. And so it makes great nurses. I love my fellowship nurses because they already know how to talk to patients. They know how to teach patients. They are some of my best nurses for educating patients because when people who are straight ICU nurses sometimes just do not know how to talk to a patient because they are so used to everybody being intubated and sedated. And so then when they start talking, they're like, well, I don't know what to do with you. And my fellowship nurses, they can educate, they can talk, they know how to communicate well. I love a fellowship nurse. I'm not going to lie, like they are my passion. And they make really good nurses because acute care, it gives you such good nursing foundations. So do not disparage acute care. Even if ICU is your dream, you're going to be a better nurse for being in acute care for a couple of years. It's going to make you a stronger, more well-rounded, more prepared nurse. But yes, that's the fellowship program. And so then it's much more abbreviated version. So you're just spending 12 to 14 weeks in the fellowship. You're doing some classes, some online modules, and then with the preceptor, and then we let you on your own and kind of build you into it.
Do you give fellowship nurses priority over new grads?
Yes, I mean, I usually hire more fellowship nurses. When I'm divvying up my numbers, I definitely am looking for more fellowship nurses than I am for new grads. So I do definitely.
Okay, we want to respect their time because it's 5 o'clock. And so I just really appreciate you guys to know as a former BRAC nurse. And also I teach in the professional nursing management class. You guys basically just affirmed everything I can teach you. So I'm especially me feel really good up here. So thank you guys for tuning in and thank you guys again for coming, and that's a wrap.